Welcome to the Smiles Are Wild channel, brought to you by Pediatric Dental Associates and Orthodontics. My name is Amy Morgan. We will be bringing you fun and educational videos weekly to help you take better care of your child's oral health care needs at home and on the go. Make sure to subscribe and turn on notifications to see all of our new videos. And remember, it doesn't really matter how you take care of your teeth as long as you take care of them from the beginning. Hello, good morning everyone. My name is Amy Morgan. I'm the marketing coordinator here at Pediatric Dental Associates and Orthodontics. I do want to start off with just a few housekeeping items today. Just remember, if you're watching this video with us on Facebook, to go ahead and like us here so you can be continually updated with everything we have going on in the office. We can also be followed on Instagram at Smiles Are Wild, and we also can make any appointments, anything like that, on our website at smilesarewild.com. And today we have a very special guest on our video. This is Dr. Garrett Sanders. He works with us here in our Bentonville location and occasionally can be found in our Fayetteville location. We're very happy to have him here. I am going to go ahead and let him introduce himself and kind of tell us kind of how long he's been a dentist, things like that, a little bit about his family, and then we'll get started with our video.
Hey guys, I'm Garrett. I've been at PDA now. This is going on 5 years. I'm from the area, local guy, born in Rogers, lived there pretty much my whole life, went to school in Memphis at Tennessee, and then me and my family moved to Cincinnati for pediatric residency for 2 years, and then came right back home here to practice. I've got a wife, Rachel, and two little boys, Briar and Bauer. Briar's 3.5, Bauer's 18 months.
Nice. All right. Well, we're glad to have you back. His wife, Rachel, actually worked here with us, so that was very, very cool connection and how we got him back. So that's very cool. So today we're going to talk a little bit about thumb and finger sucking, pacifiers, things like that. We get a lot of questions from parents where they want to know kind of, more about when they should stop and how to get them to stop. But we're going to kind of talk about what it is, why it's important to stop, especially when it's, a comfort for them and things like that. But kind of dentally and for their oral health, kind of how we can prevent some of those future orthodontic issues if we stop early. So one of the first questions that we have is just kind of why do they do this, and is it normal for them to suck their thumb or use a pacifier?
Sure. So definitely. So there is a lot of negative out there about oral habits, kids sucking pacifiers or their thumb, whatever the case may be, because of what can come about later on. But really, it's a normal thing. You'll see infants in the womb with thumb habits already. It's a self-soothing thing. It is, it's desirable in a lot of respects. It's a way they learn to cope. It actually gives them an endorphin feedback, almost like, it's like any good positive thing that you would feel that would make you want to do something again. When they suck their thumb, it makes them feel good and it calms them, and then they'll want to do it again, and it can become almost addictive in that respect because they use it as a coping mechanism, and then because they get that positive feedback from it, then they'll use it over and over and then can start to use it in non-self-coping ways. And that's when it becomes more of a problem, whenever it kind of outlives its value, so to speak. Little babies, it's great. Pediatricians would say that even in some cases that SIDS can be less prevalent in babies that use pacifiers. And then just from like a mom and dad happiness standpoint, if baby can self-soothe with these things, it's good. So it's great. It's just when it can become addictive and when it can become something they rely on for too long, that's when trouble starts. So it's not harmful. It just has to be monitored. A normal age range would be around 3, would be when it crosses over into maybe outstaying its welcome a little bit.
Okay, that's great. So you and I discussed a little bit before we recorded about a non-nutritive sucking habit. So let's talk a little bit about that, kind of how you described it to me, kind of what is considered a non-nutritive.
So if you have questions or if you wanted to do Google search or whatever about this stuff, the phrase you would look up would be a non-nutritive oral habit or a non-nutritive sucking habit. And basically what that means is when the child is placing something, whether it be a pacifier, a finger, 2 fingers, a knuckle, a blanket, a toy, whatever it might be, in their mouth without a food or nutrition benefit, that's a non-nutritive sucking habit.
Okay, and then, obviously we're on here talking about it because obviously there are some negative effects there. So can you talk a little bit about what those are?
Sure. So basically the long and the short of it, as far as the oral ramifications of these habits, is that whenever you place a thumb or another non-food item in the mouth and they apply either biting or suction force, it's creating an irregular force. And so what keeps our teeth where we want them to be is the pressure of the lip and the tongue, and it's all in balance. When you enter in this hard biting persistent force, or the suction force, it can compress or flare the skeletal and dental alignment. And so depending on how frequent the kids do it and the duration that they do it, it can be a pretty profound amount of force. So think about it like braces. So braces is all about applying a light amount of force to the teeth over a long period of time. And so the wire is pressing on the teeth all day, all the time, just a little, and you can get really profound movement. An oral habit is the exact same concept. If they're got that thumb in there all the time, all day, constant force, it'll apply that same sort of shifting force that orthodontics would, but it's not controlled. So you have no handle on where the teeth are going to go or what it's going to do. And so it can have some pretty profound impacts on the alignment.
Sure. Okay. And then you touched on this just a little bit, but ideally, when should we stop? And kind of talk about, does the amount of the habit have a lot to do with when they should stop?
Sure. So basically, based off what I just said, depending on the individual child, if they're still sucking their thumb or a finger, or rare cases of pacifier past age 3, but it's a very infrequent thing and it's a short duration, so they briefly place the thumb at nighttime for 5 minutes and then fall asleep and then that's it, that's not particularly harmful, because again, it's duration. But if you have a kiddo that's doing it for long periods of time and you're seeing changes, it becomes more urgent. 3 is a good ballpark, but it's not universal. There are kids that I see that are 18 months old that have really been leaning on the pacifier or a finger and already have really profound arcing of the front teeth. They're flaring when the molars are, fully biting together. Normally your front teeth would overlap, but in these kids, when they're fully biting together, their front teeth are gapped. You can sometimes even take a finger and place it in between their front teeth, even though their molars are touching. You'll see that in kids even as young as like 18 months. And so for them, the 3-year average thing is not that great. So if you Google search it and it says stop by 3, it's not a one size fits all, but it's a good ballpark.
Sure. Okay. That's helpful. And then, of course, the question that's going to come from most parents is, okay, that's great. What do I do to stop it? What are some techniques that I can use as a parent to stop that?
The tricky thing about oral habits is that, especially depending on your parenting philosophy, we generally want to stay away from punitive methods of getting the kids to stop. And so it's common for parents to get frustrated. They're thinking maybe this is going to cost me a lot of money later if the alignment's all messed up and now I'm going to have to put the child in braces, or socially they're embarrassed because their child is 7 and won't get their fingers out of their mouth, or whatever the case may be. You'll see parents that feel pressure to get the child to stop, and a lot of times the kids don't want to stop, and so the tendency is to want to go with punitive approaches, and they usually just don't work that good. So you can, but it's hard or undesirable a lot of times to try to force the child to stop. What we're really looking for is buy-in. And so by 3, most kids have enough language that you can have a dialogue with your child. You can start to explain to them why this is important, negative consequence, positively reinforcing them when they're not doing it, coming up with reward systems or star charts or prizes or things if they've been good. Start working through that mentality, and then even if the child doesn't stop right away, you're laying a foundation of why it's important to stop. Then later, when the child starts to buy in, even if they're still doing it, then we can do some of the things that could be viewed as punitive depending on circumstances. So like topical things on their fingernails that taste bad, or appliances, those will serve as a very abrupt reminder that they need to get that out of their mouth, but with the child understanding why. If you have a kid that still wants to do it and they have no desire to stop, and you do one of those techniques, it usually just creates angst. It isn't desirable. So it's case dependent, but you want to start at 3. If they're still doing it, you want to start dialoguing with your child about why we need to stop, and kind of getting that conversation going so that there's receptiveness to it later.
Sure. Are there any special things you can do for kids that may have sensory issues or any type of neurological dysfunction?
Sure. So you'll see, kids with certain oral sensory things or neurological issues, sometimes they'll have oral habits that are much more deeply rooted, and they're hard even when the child is aware, even whenever you're doing some of those more invasive techniques to try to get them to stop. Sometimes it's just difficult, or the child may feel like they need to do it, or they can't help themselves, or whatever the case may be. And in those situations, occupational therapy sometimes is helpful, just to help work through the child a little bit more, specifically and more intentionally than what a parent typically has the training or time to do. It can be valuable, but that's a case by case thing.
Sure, absolutely. Okay, is there any other bit of advice you want to give to parents? Other than just let them
I think
work it out.
The thing that I would tell people is that ideally, yes, we want them to stop the oral habits. Yes, there are some consequences, but at the end of the day, none of this stuff is that big of a deal. Even kids with pretty profound dental change at 3, if the habit stops, will get some self-correction. I've seen kids with really big open bites self-correct. It can fix itself, and even if it doesn't, limited orthodontic treatment can fix it. It's not the end of the world. Don't stress yourself out about it too bad. Parenting comes with enough stresses and challenges to worry too much about this. It's just good to know, so that if you can, through a little bit of intentionality, circumvent this stuff, it's good to, but it's not the end of the world.
Sure. All right. That sounds good to me. I know my daughter went through kind of the same thing, and we ended up at the appliance phase, but it did work, and now her teeth are beautiful. And so, we ended up there, but it did take some time. And, the doctors here worked with me very closely to make sure that we were doing the right things before we had to head into an appliance. So just know that, even as an employee here, my own child has gone through that same thing. And, we go through brushing issues and all those kinds of things. And I'm sure your sons they love to brush, don't they? They're just all over it.
Every day is a new adventure.
Right. So anyway, this is all we have for today as far as that subject. We want to say thank you so much for joining us. We really appreciate you taking the time to watch these videos. And to share them with your family and friends. We also want to thank Dr. Garrett for coming on today. This was a big move for me that I got him to do it, so I'm very proud. Again, if you have any questions, please feel free to call our office. We can be reached at 479-582-0600. You can also email me directly. I'm happy to answer these questions. I have a lot of good one-on-one contact with the doctor, so if there's something specific that you want to know, we could talk about whether or not that needs to warrant an appointment or anything like that. My email is amy@smilesarewild.com. And you can always find a lot of this information as well on our website, but you can also look at the American Academy of Pediatric Dentistry, which is aapd.org. And again, thank you for joining us. Thank you so much for watching. Make sure to subscribe and go visit us on smilesarewild.com.